So today we will be discussing the electromyography guided adjustment of an occlusal appliance, effect on pain perceptions related with temporomandibular joint disorders, a controlled clinical study published in the journal Diagnostics with an impact factor of 5 in the year 2021. So coming to the novelty of the study compares the effectiveness of the EMG guided occlusal appliances which were adjusted compared with the normal conventional adjustment methods for managing TMD pain. It introduces the use of the surface EMG as a digital procedure for adjustment of the occlusal appliances and the intraoral appliances. So the aims and objectives of the study was to evaluate the effect of an EMG guided adjustment of the occlusal appliance on the management of the TMD related pain and to compare this method with a standard clinical procedure for adjusting occlusal appliances. The objectives were to assess and compare the muscle pain to palpation, pain during movements, jaw movements and headache in patients treated with EMG guided occlusal therapy versus conventionally adjusted appliances using manual approach. To measure these pain parameters, they had used the VAS scores at 3 time points, that is before the treatment at the beginning, 4 weeks after the treatment, that is T1, and 8 weeks after the treatment, that is T2, and to determine whether the EMG guided levels lead to better or faster pain reduction compared with the conventional methods. So these points are derived from the study's description and do not directly quote the text, and no exact quotes from where the data was summarized were given. So coming to the materials and methodology, the study design was approved by the Ethics Committee of the University of L'Aquila, Italy. Data were collected from 40 adult patients, 20 males and 20 females. Age range was 20 to 30 years with an average age of 25 years. Patient characteristics, the patient comprised who have pain of the muscle origin, headache and masticatory muscle pain to palpation, pain during mandibular movements. None had disc displacement or degenerative joint disease. Treatment, all patients treated with individualized 1.5 mm thick occlusal appliance. One was adjusted conventionally and one using the surface EMG. The appliance was made of heat cured acrylic resin and applied to the lower jaw. The group division, the first group, the appliance was calibrated and performed using the surface electromyography, and the second one, and it measured the activity of the masticatory muscles. Control group had the appliance calibrated by the standard procedure, and the EMG device was Ethan. For surface, this device was used for surface EMG. It is a 4-channel wireless electromyograph where surface electrodes were placed on the masseter and the anterior temporalis muscles of the patients. And the treatment protocol, the control group and the experimental group were the patients were told to wear the appliance for 22 hours per day, remove it only for meals, and all patients were treated by same expert operator. No inter-operator variability was there. Assessment was done by the VAS score, ranged from 0 to 100. Parameters that were objectified in this statement were muscle pain at palpation, pain during mandibular function, that is the functional pain during movement, and pain due to headache. Follow-ups were scheduled at 4 weeks, 8 weeks, and from the initial phase, that is the start of the study. Overall findings, both groups showed a reduction in pain. The study group, the surface EMG guided adjustment, showed a better trend compared to the control group. Muscle pain at palpation at the baseline or the start of the study, no significant difference between the groups was evaluated. At 8 weeks, the study group had significantly lower VAS score, more than the control group. And in the study group, at 4 weeks, at T1 time, it remained stable compared to T2. And control group at T1 time, that is at 4 weeks, a slight decrease compared to the T2 group, that is 8 weeks. Functional pain at T0, no significant difference was evaluated. At T1, that is the 4 weeks time period, study group showed statistically significant lower VAS scores than the control group, and there was no statistically significant differences at T2 time period also, that is the 8 weeks. Study group, significant reduction from T0 to T1 and T0 to T2 was evaluated. In control group, there was also significant decrease similar to the above. At headache, for the point of headache originating pain, at T0, no significant difference between the two groups. At T1, that is 4 weeks time period, the study group had significantly lower VAS scores, and same for T2. And for the control group, slower decrease was there, becoming significant at T2. Improvement percentages, in terms of percentages, if we talk about muscle pain at palpation, from T0 to T1, there was 72.2% improvement. In headache origin of pain, 68.5%. In functional pain, that is the movements of the jaw, 66.6% improvement in the experimental group. In the control group, muscular pain at palpation, 60% improvement was seen. In the headache group, 13% improvement was only seen. And in the functional pain, only 36% of improvement was seen. So, in the long-term effects, talking about the long-term effects, study group maintained the improvements from T1 to T2. Control groups showed some recurrence of muscle pain to palpation between T1 and T2. And 41% of the cases had worsening pain outcomes. Statistical analysis used were Shapiro-Wilk test used to confirm the normal distribution of data. The test confirmed that muscular pain and headache were normally distributed, but functional pain was not. Independent t-test for the sample and one-way ANOVA used for normally distributed data. Independent t-test showed that group 1 had significantly lower pain levels than compared to group 1 at T1 intervals and T2 intervals both. One-way ANOVA and Tukey's test was done, which revealed that pain reduction over time was faster in group 1 as compared to group 2, and group 2 showed lower improvement. And Mann-Whitney U test indicated that the functional pain was significantly lower in group 1 compared to group 1 at T1 stage, that is at the 4-week stage. And the last test was the Wilcoxon test, and the Friedman test confirmed significant pain reduction in group 1 after 4 weeks, and group 2 had a slower pain relief. So coming to the strengths of the study, it is a controlled clinical study comparing two adjustment methods. First is the manual method and the second is the surface EMG guided occlusal appliance. Use of the control group allows for direct comparison. Sample size and composition, adequate sample size was there. Gender balance was there, 20 males and 20 females. Narrow age range, 20 to 30 years with average of 25 years. Standardization, all patients treated with the same type of the occlusal appliance, no variability in the occlusal appliance. Single operator performed all the treatments, so no variability. Assessment methods, VAS score was assessed for pain, headache, functional pain and the muscle pain. Follow-up at various weeks, beginning of the stage, 4 weeks and 8 weeks, allowing assessment of both short-term and long-term assessment. Statistical analysis, significant level of clarity was defined, and ethical considerations, it was approved by the ethical committee of the institution. Limitations, sample size was small with a limited age range with average age of 25 years, which may not be representative of the entire TMD population, and it had only patients, it excluded patients with disc displacement and degenerative joint disease, so another study can be done in those patients. Study duration, it had a short follow-up period, relatively of 8 weeks, so it can be done for longer periods of time, that is 1 year, 2 years and so on. Blinding, how the patients were blinded before the control group and the experimental group, we had no information about it. Control group treatment, how limited details were informed about the conventional adjustment, how it was manually adjusted, and outcome measures, reliance on subjective pain measures. VAS scores are subjective, so it is without any objective or clinical or imaging assessments were not done. and no confounding factors whether patients were using any medications before or after or during the treatment. That medication history was not given. It was a single center study, so it was which cannot be generalized to the entire population. And how the EMG, that appliance, worked and how the guided adjustments were done, that there we have a lack of information and limited exploration of the underlying mechanisms by which EMG guided adjustment might lead to better outcomes. So future scope, we can expand the patient population to a wider variety of patients and include patients with disc displacement, without disc displacement, and degenerative diseases can be included. And long-term follow-up can be done at specific time intervals, 1 to 5 years and so on. Comparison with imaging studies can be done. Only relying on VAS scores is not good, and investigates the effectiveness of the EMG guided for different types of occlusal appliances. This was for acrylic. Other occlusal appliances can also be incorporated into the study. Cost-effective analysis, how this study is cost-effective, and standardization of the EMG procedure, develop and validate standardized protocols to adjust the consistency across all practitioners. Quality of life assessment can be done, and it can be done at multi-centers, and personalized treatment approaches based on these effects can be done for a larger group of patients. Thank you so much.